Hey guys, welcome back to my YouTube channel. Today I'll be discussing about the topic breast cancer. So without wasting much time, let us start with our topic. So firstly, a brief introduction about a disease condition. So breast cancer is a disease that mainly affecting the breast cells or its different parts of the breast where the growth is uncontrolled way, and it will form tumors and it will be spread to the nearest part already, as I have mentioned, and it becomes fatal, and the prognosis, it becomes worse if it is not treated properly or if it is not diagnosed in the first and second stage. Now moving for the definition. So breast cancer is defined as a malignant tumor that develops from the cells of the breast. As per WHO, it says that it is a malignant tumor when any kind of tumor or any kind of lump, if it is present in the breast and if it begins from the cells of the breast. Then if we see the incidence in the worldwide, it has been found that in the year 2023 there were 2.3 million women were diagnosed with breast cancer, and approx 6,70,000 deaths has occurred globally. And basically 1 in 12 women will be diagnosed with breast cancer in their lifetime, as per the Human Development Index. And out of 71, 1% of women will die if they don't get proper treatment. So if we see the national statistical data, according to the study conducted on breast cancer survival in India across 11 geographic areas under the National Cancer Registry Program in 2024, it has been found that breast cancer is the most common cause of cancer in India, and approximately 28.2% of women, they will have this breast cancer. And it has been found that there are already 2022 the cases were registered, like 2,16,108 cases were registered with breast cancer. So at first, let me give a brief introduction about the related anatomy and physiology of breast. So you all know that everyone we have breast. It's not that only women they will have breast cancer or only women they have breast. So both male and female they have breast, right? So it is composed of glandular tissue, connective tissue, or you can say it is made up of adipose tissue, that is comprises of fats tissue. And in case of male, this breast, it becomes underdeveloped, or you can say it is rudimentary organ, okay. But in female, it plays a very important role from the reproductive age to pregnancy, and again in lactation also. So if we see the structure or the different parts of breast, we can see that breast, it contains lobules. Actually the lobules are the milk producing glands, and it has duct. So these ducts will carry the channels, or you can say it will carry the milk towards the lobules. And the breast is hormonally responsive, and it functions, it gets changes from puberty, during menstrual cycle, even in pregnancy, lactation, and even in menopause, as I have said. And it comprises of 15 to 20 lobes, and it is further made up of smaller units, and this is the lobules. So lobules, already I have mentioned that they are the glands, and it will produce milk. And this duct, you can see in the diagram, they will carry the milk from the lobules, it will get travel through the duct to the nipple, okay. And if we see the most of the cancer cases, it begins in the duct, and for that we can say that mostly the cancer, it can also occur in the ductal, and we can say as ductal carcinoma. Then again we have areola. So in the areola there are pigmented structure, and this pigmented area around the nipple is the areola only. And most breast cancer, it also begin from the duct, as I have mentioned. So it is ductal carcinoma. Then the nipple is the outermost part, the outlet part. And if we see the other parts, like if we talk about the lymph nodes and vessels. So again, it is a part of the human and drainage system, and axillary lymph node is present underarm, and supraclavicular lymph node is present, and internal mammary nodes are also the key points where the breast cancer it gets spread. Okay, so it is a brief anatomy, brief anatomy regarding breast. And if we see the functions of breast or the physiology of breast, we can see that it helps in the hormonal regulation. So what kind of hormonal regulation? In estrogen, so it stimulates the ductal growth and fat deposition with the help of estrogen hormone. Then progesterone hormone, so it promotes the alveolar development. Then after the pregnancy, in the lactation period, with the help of the prolactin, it will stimulate the milk production, and this process is called lactogenesis. And with the help of oxytocin hormone, the milk will get ejected. Then during puberty, what will happen? Under the influence of estrogen, again under the hormonal effect, the breast it begins to get enlarged due to the ductal growth and due to fat deposition, and here progesterone will also help to develop the lobules and alveoli. Then in menstrual cycle, if we see in the different cycle of menses, there will be fluctuation of the hormone levels. Okay, and you all know that during the premenstrual phase, what will happen? There will be breast swellings, slight tenderness in the breast. Some people, they may face these premenstrual symptoms, right? They will feel fullness may occur due to the ductal and lobular proliferations, so it's normal. Then in pregnancy and lactation also, the breast it grows rapidly, so because of the again hormonal level, like increased level of estrogen, progesterone and HPL, that is the human placental lactogen hormone. It helps, it plays a supportive role. Then if we see the in lactation, what will happen? After the delivery of the baby, again there will be drop down of the estrogen and progesterone hormone, and it will allow the prolactin to initiate the milk production. Okay, so these are some few functions of a breast. Now if we see the etiology and risk factors, so first etiology is the women. So women are at more risk as compared to the men. It's not that men will not may not get breast cancer, but they may also suffer, but their percentage is very low. Like 1% of the men, they will have breast cancer or they will suffer from breast cancer. And if we see the incidence, basically the incidence of breast cancer in women is under 25 years of age, is very low, and it gradually increases after the age of 40 to 50s. Okay, then second risk factor, you can say, like hormonal use. Suppose the women, she is consuming hormonal tablets like in the form of OCPs or due to other disease conditions, so it may lead to breast cancer in her future life. Like if the person is taking like estrogen therapy alone for longer than 10 years, then it increases her risk for the breast cancer. Why? Because the hormones estrogen and progesterone, they will act as a tumor promoter. They will help to grow the any kind of, if tumor has been grown, so it will help to grow the tumor rapidly. Suppose if there is any kind of damage to the tissue or any kind of cell impairment, then it will promote more growth. Okay, then next risk factor is family history, or you can say genetic factors. So family history, it is important risk factors, especially if the involved family member also had ovarian cancer, or if there is a bilateral breast cancer history, or if the first degree relative history, it's mainly matters, like mother or sister or any kind of first degree relative. If they are having genetic history or family history of getting cancer, then it is again a high risk. Then if we see the genetic factor, so about 5 to 10% of breast cancer are hereditary. Okay, and we all have BRCA1 and BRCA2 gene, BRCA1 and 2 gene. But what will happen in case of breast cancer, this gene will get mutated, or generally this gene are located on chromosome 17, and it helps to suppress the tumor, any kind of tumor if it grows. Okay, but in case of mutations, so these genes can get, what will happen, the tumor suppressor gene will not able to suppress the any kind of tumor if it is growing, and inhibits the tumor development. So again, due to these mutations, BRCA1 and BRCA2 gene, approximately 40% to 80% of women, they can get breast cancer. Then smoking and alcohol consumption, again it may alter the DNA functions, or any kind of impairment or injury to the cells may lead to breast cancer. Then early menarche, that is before the age of 12, late menopause, later after 55, so that also may increase the risks. Then exposure to ionizing radiation, especially for the healthcare workers, or occupational hazards, this may lead to damage to the DNA. Or suppose patients, he or she is admitted to hospital for the radiation therapy by getting a particular cancer, but in her later life, due to that radiation, again other organs may get affected, or she may get other cancer. So that is due to the exposure to ionizing radiation. Then again, obesity, it increases the risk of breast cancer, and lack of physical activity also it will increase, because it will again affect the hormonal level in the body. Okay, then fat deposition also, in case of obesity, will increase the risk for developing the breast cancer. Now moving forward for the pathophysiology. So due to the different etiological factors, what will happen, there will be damage to the DNA, and if there is any kind of impairment or cell injury, and if the DNA gets damaged, there will be mutation of the gene. After getting mutated, the gene, the tumor cells, the normal tumor suppressor gene will not able to stop the mutations, or they will not able to stop the growth of extra tumor or extra cells. So it will affect the normal cells, and it will increase the number of cells, and again there will be growth of the colony, there will be progression of the tumor, it will be more increasing rapidly, and ultimately there will be breast cancer. Okay, so I hope it is clear. And due to different etiological factors, or like the cancer causing agents, it will cause damage to the DNA. Okay, so different etiological factors are only mainly responsible to cause the impairment of the DNA or injury to the cell. Okay, now let us know about the types of breast cancer. So if we see the types, it is classified based on tissue type, secondly based on invasiveness. Okay, so based on tissue type, the breast cancer is classified as ductal carcinoma, that is, if the cancer it is affecting the duct, then it is ductal carcinoma. So in ductal carcinoma also we get three types. One is medullary, you can note it down, secondly tubular, third is colloid. So in case of medullary, it is the rare one, and it grows quickly. Okay, here it gets metastasis very fast. Then tubular and colloid, both will grow slowly, and they are very small tube like tumor or small tube like structure it develops, and here the prognosis is good comparatively. And colloid type, here there will be lot of mucus secretion, jelly like appearance, usually grow slowly, and here also the prognosis is good. Then under based on tissue type, one we have learned about ductal carcinoma. So under ductal carcinoma only we have got medullary, tubular and colloid, and under the tissue type only second type is lobular. So it will basically affect the lobes and lobules, that is the milk producing glands. Okay, it starts affecting the milk and followed by the other nearest glands. Then second part is the based on invasiveness. One is non-invasive breast cancer, invasiveness. So non-invasiveness like ductal carcinoma, that will be in situ, that will here the cancer it will affect only the milk duct only, like lobular carcinoma in situ, that is only in the lobules only. But invasiveness, it will, what will happen, it will start from the duct and it gets invaded to the nearest parts, okay, nearest tissue. So again for the invasiveness type, it is lobular, which, or you can say ductal. It is the prognosis is not much good. Okay, so these are the types. Now if we see the clinical manifestations, so what will happen, the patient will have enlargement of a lump, or you can see presence of lump in her breast. Especially it is most common in the upper quadrant, outer quadrant of the breast. Okay, and if it is felt, you can see, if you feel it, like if we do assessment of the patient, then we'll find that it is hard. Okay, if it is palpable, then there will be asymmetrical breast, means the symmetry will not be same in both of the breast, that, or you can say there will be changes in breast shape or size, it is a symptom. Then pain in the breast or the nipple. Then again you can see dimpling, or there will be orange peel, like the skin of the breast, it will get like orange peel appearance, that is dimpling or puckering will be present, and there will be redness or scaling. Okay, so that term is called as PUD orange appearance in case of breast cancer. Then again there will be pain in the axilla, there will be axillary symptoms, or sometimes there will be ditchers from the nipple. Okay, so these are some common signs and symptoms faced by the patient. So coming for the diagnostic findings, so mammogram, or you can say radiographic findings, where it is like a X-ray, where the examination of breast is done. It is basically used to diagnose the breast cancer. It helps it with the help of the X-ray or images of the breast. It is given low dose X-ray, so breast is compressed and it is kept between the two plates to spread out the tissue, it helps to improve the image quality. Okay, then again fine needle aspiration is done on outpatient basis, also it can be done, or inpatient basis also it can be done. So here the main purpose is to identify whether the lump is solid or liquid, or whether it is cancerous, or it is only not non-cancerous, like some due to presence of cyst also there may be some fluid accumulation, or there can be discharge. So for that it is it's usually it confirms whether the mass is cancerous or not. Okay, apparent diagnosis is mainly confirmed. So if the mass turns out to be a cyst, so the lump, after aspiring the fluid, it will be dissolved after some days. And if it is solid, again a cytologic examination, the specimen should be obtained from the patient. Okay, then stereotactic needle guided biopsy. So in here what is done, mainly used to target and identify the non-palpable lesions in the breast that have been detected with mammography. And here basically the breast is immobilized, breast is fixed with the help of the horizontal and vertical coordinates, and here exact location is able to identify it with the help of three-dimensional field, that is stereotactic needle guided biopsy. And fourthly is the ultrasound core biopsy, where biopsy is done with the help of ultrasound. So ultrasound guided biopsy, it helps when the lesion can be seen on ultrasound, so it is easier for the client as compared to the stereotactic biopsy where the breast is kept immobilized. Here there is no requirement of immobilization. So with the help of the large core biopsy needle, this ultrasound guided biopsy is done. Then again open biopsy, where a small incision is made in the breast tissue, and there the tissue or the sample are collected after making a direct incision. Okay, so these are a few diagnostic managements, diagnostic evaluations, or you can say diagnostic procedures that are done mainly for the breast cancer cases. Then also one I have not included in the slide, that is the genomic assay. So here the HCR2 gene is usually identified. Overexpression of this receptor is associated with aggressive growth of the tumor, and it will again lead to greater risks for the reoccurrence and a very poor prognosis of the breast cancer. Okay, and HCR2 is overexpressed approximately 10 to 20% of patients with breast cancer. So it is based that if HCR2 it comes negative in case of breast cancer patients. Then management, so drug therapy, so for destroying the cancer cells or the tumor cells. In every cancer we used to give chemotherapy. So these are the cytotoxic drugs that are used mainly to destroy the cancer cell, or the size it can be reduced. Then immunotherapy. So what will happen in immunotherapy? Here if there is any kind of genetic change in the breast, but with the help of the immune system, they try to naturally reduce the size of the breast. So special drugs are developed to specify the target cells, and here they will alter the genetic gene, cancer causing gene they will alter, and they will reinsert. Firstly they will take out the gene, the gene that is defective, they will remove it, and after that they will insert the corrected gene, okay, that they have corrected with the help of the new vaccines or some immunotherapy. And if they are unable to take out the gene by removing it, so what they will do, they will directly give some targeted dose to that particular cells only. Then again this is targeted therapy, it is done already. Then radiotherapy. So in radiation therapy what will happen, it is used to prevent local breast cancer recurrence, and after doing surgery also radiotherapy is done, where with the help of the radiations or beam of energy the cells are destroyed, or the size it can be reduced. Okay, so external beam radiation. So when radiation therapy is the primary treatment, they usually perform after surgery for the breast cancer, and after mastectomy it has been seen that radiation therapy is more effective. Then brachytherapy, it is with the help of short distance that treatment is given, means by inserting a catheter probe to the patient's body, and they will provide internally, or they will give some radioactive isotope material to their body, and it will help to reduce the size. Okay, that is the brachytherapy. Or you can say it is an alternative treatment where external radiation treatment for some patient it doesn't work. Then surgical management for breast cancer. So for surgical management, so basically the main goal is to preserve the breast. So for that mastectomy, in where it depends actually for mastectomy. So mastectomy is the treatment of choice when the following conditions apply, like if the tumor it involves the nipple areola, or if the tumor is larger than 7 centimeter, or if the tumor it exhibits the ducts, and if multiple quadrants of the breast are affected, then mastectomy can be done. And if the women, they are not able to comply with the radiation therapy, then the complete breast tissue are removed. So that is the mastectomy. Then simple mastectomy, so here the removal of the breast and there will be preservation of the pectoralis muscle. Okay. Then modified radical mastectomy, here there will be removal of the breast with pectoralis muscle and with ALND, that is the axillary lymph node dissection will be there. Other surgery like transverse rectus abdominis musculocutaneous flap, or you can say deep inferior epigastric artery perforated flap, where from the other part of the body, like the flap, like from the abdomen or from the thigh, it gets transferred to the breast area. So flap also it can be done to preserve the shape and to preserve the size